Hello. Today we are going to talk about sleep apnea. A lot of people suffer from this. Roughly 25 million people in the United States alone suffer from obstructive sleep apnea, which basically we're going to get into that. There's a couple of different ones, but it causes snoring. It causes all sorts of other disruptions. Basically, it's when you are interrupting your normal breathing pattern and not getting the oxygen that you need. Let's dig in. So there are three different types of sleep apnea. There's obstructive sleep apnea, which is the most common form and occurs when the throat muscles relax too much. This is often the kind that we see most people have, and where you get that breathing, blocked airway, and it causes the snoring. There's central sleep apnea, which is when your brain doesn't send the proper signals and that control the muscles that breathe, and you stop breathing from that. And then there's complex sleep apnea, which has an emergent treatment which needs emergent treatment. And it causes when somebody has both obstructive and central sleep apnea. So basically their airway is blocked, and then the brain is not getting the right signals to the muscles to cause the breathing to happen. So you can see over here in the picture that when we are normally breathing, our airway is nice and open even when we're sleeping. But then when you actually have sleep apnea, oftentimes the tongue is relaxed too much and it drops back and it closes off that airway. And so that's why we're lacking the oxygen that we really need. So what does it do? It affects your whole body. It can cause stroke because it damages your blood vessels. It can cause loss of vision through retinopathy and glaucoma. Can increase your risk for kidney disease. Increases your risk of bone loss because of calcium elimination. Increases your likelihood of developing dementia from the lack of oxygen, increases your depression and anxiety risk and mood disorders leading to that, and increases your risk for heart disease. Sleep apnea, we see a lot of that in our heart patients, especially with heart failure and chest pain. And then it increases the risk of sexual problems as well, like erectile dysfunction and decreased libido. And a lot of times, a lot of these are related to that whole lack of sleep to the body. So let's talk about who is at risk for sleep apnea. So anybody that is carrying around extra weight, because that extra weight, most of us will carry it around in the belly area, and what that'll do is it decreases the ability of those lungs to expand and everything. Plus, when you have excess weight, and especially in the chest or upper area, when you lay back and you relax, you're actually you can compress that a little bit more. Your neck circumference, so those with thicker necks have narrower airways because of all the musculature in there. If you have a predisposition for a narrowed airway, men are 2 to 3 times more likely to develop sleep apnea than women. And women are at increased risk if they are overweight and also after menopause. Being older, so unfortunately our age has an effect on it, and so you're going to see it a little bit more in those older adults, and that's a lot of it's related there to just the muscle loss at that point. So the sarcopenia that can go on as you get older, which is why it's so important that you exercise to prevent that. Family history, if you have a predisposition, just like with most disease factors, this is going to factor in as well. You can't beat genetics. Increased use of alcohol, sedatives, or tranquilizers. All those things are going to make everything relax in your body, and that includes the muscles in your throat. Smoking. Smokers are 3 times more likely to develop obstructive sleep apnea, and it's because of all the inflammation and fluid retention that is developed around the airways causing from that smoking. And then nasal congestion, and I'm sure you've noticed if your partner or spouse is a little bit more congested, they have a cold or allergies have kicked up, they tend to have a lot more snoring going on. And so that increased nasal congestion, because you are more likely to breathe through your mouth than your nose when you're having that, can cause that increase in risk of sleep apnea. So obstructive sleep apnea, what you can do is they're going to put you on if it is a chronic issue and it's not just because you've had increased allergies or something, and it's developing and it's causing symptoms over time, you're going to use a CPAP or a BiPAP. And so what those are designed to do is they actually use pressure that comes in through your nose and your mouth, depending on which mask that you have and which mask fits you, that will keep those airways open. So it stands for positive airway pressure. is the PAP on it. And then the C versus the BI is just how many forces that are being used. So the setting is prescribed by your physician, so that's really where that comes from. And then making sure that you clean your machine on a regular basis, because just like we talked about in the triggers and exacerbations PowerPoint, we don't want you to breathe in mold and mildew, because that's just going to cause all sorts of issues down the road. So let's talk about it. So how do you clean your machine? Well, you're going to remove it, clean the humidifier carefully so that water doesn't enter your CPAP, make sure all the locks are on there, open the chamber, wash everything out with soapy water, rinse well, and then allow it to dry, and then using a clean cloth or paper towel, you can wipe it out and then allow it to dry outside of direct sunlight, because that sunlight's going to actually cause it to increase that mold. Use distilled or sterile water. That's why they sell it in stores. Don't use tap water. It contains too many minerals and chemicals. Same reason why you wouldn't use tap water when you're making your coffee with the fancy machine. So you just got to kind of keep that in mind. Once a week, the humidifier chamber should be soaked in a solution, part vinegar and part water, for about 15 to 20 minutes, and that's just to make sure that you're cleaning it thoroughly again. And then some are dishwasher safe, which is nice, and you can use that. And then they should be replaced. The chamber should be replaced every 6 months or as needed. They also make a ionized machine that will clean it for you nowadays. A lot of our patients that have had it had said that it has been the best investment of their money thus far, because they don't have to worry about cleaning it properly. It does all the work for them. It actually uses ions to clean the machine for you, which is often what we are using in the hospital as well, to clean rooms that have been contaminated. So that helps a lot, but it is a little bit pricey of an investment. But those that have made it have really enjoyed it. So if you don't use your CPAP, what can happen? High blood pressure. So a lot of times what we'll see is when people start suffering from sleep apnea, these are the things that we're going to see, and kind of tends to lead us to investigating, oh, okay, what's going on? And that sleep study will definitely cement this into it. So high blood pressure is often one of the side effects, which can lead to stroke. It can lead to heart failure, irregular heartbeats, and heart attacks. Not using your CPAP machine can lead to increased risk of diabetes, especially if you have the predisposition to it already with your body build. Depression, worsening ADHD, so worsening, and again, that's related to the mental health there a little bit. And so you just don't have the functioning availability. And then increased headaches. So having those increased headaches because you're not getting the oxygen that you need can lead to that as well. So please let us know if you have any questions about sleep apnea. We would be more than happy to talk with you guys about it, and hope you have a great day. Goodbye.